welcome to What's the Buzz podcast.
Yeah, thank you.
I'm so excited you're here. So everyone, we have Dr. Thomas Nabors. This is someone who I have been following for a very, very long time, and they are one of the innovators in dentistry, and one I would say is one of the best cosmetic dentists in the world.
Yeah,
Um,
no, thank
I've
you.
I've been able to go to a lot of courses
Yeah,
with him. I've seen him engage with his students and his patients, and I'm just so excited to have you here today.
well,
So,
thank you. Yeah, it's
um,
fun. I really appreciate the opportunity. I think there's some really exciting things happening in dentistry and in healthcare, and to have the opportunity to kind of get that messaging out so that people really know what's available. I think this is going to be great. So thanks for having me.
we're so excited. I one of the things that's always impressed me about you and your practice is how much y'all care. It from the second I met you and your team, I just knew you're really invested in people's overall health, and that's really one of the biggest things that I wanted to talk about today. I had my mouth swabbed when I was in your office, which I've been
Right.
in thousands of dental offices, and I've
Mhm.
never had that done. So to have that experience, I can tell you from the day I went to your office to now, my mouth is healthier because of you.
Right. Well, thank you. And there's a whole team approach to all of this. As you know, in any industry, and we're really fortunate to have people on our team that really kind of buy into that, in spite of what we want to do to the teeth, that the mouth itself is a part of our body, and there's health aspects to that we have to understand, as dentists or as dental team members or hygienists, because, the gateway to our body really is through the mouth, and the oral cavity has so much information in there. And I think that's one of the most exciting things. And I know we're going to talk about that, but yeah, it should feel better after you go to the dentist, not just with your teeth and how pretty they look, let's say, but just how your body in general feels. And, it's a big deal. So I love talking about it.
Yeah, you're just making me think. I mean, how many dental appointments I've been to where they literally just looked in my mouth and said, "Looks good."
Right. Well, it's a little bit like, if we want to kind of parallel that to where medicine has gotten with physicals now. Typically you can't get a physical, with your primary care physician. And if they do, it's still the same. Stick your tongue out with the tongue depressor, say, cough a few times with the stethoscope, check your blood pressure, check your cholesterol, and then 5 minutes later, that was your physical. So that's but it's not dissimilar to the dental check. We all talk about how the hygienist does the majority of the work, and then the dentist just kind of comes in and pats everybody on the back and does a quick look, and that's that. And so I don't think that that's unusual in healthcare, but I don't think that's going to be where the standards should be. And where it goes now is a lot more on the diagnostic capability of saliva and what's happening in the oral cavity, because there's so many things that are connected to that. And I think it's way beyond, teeth. And I think dentists and dental hygienists and just everyone in dentistry ought to be really excited about the connection to healthcare. And I know you and we talk a lot about marketing and about cosmetics, but at the end of the day, if we can help our patients live longer and be healthier, and maybe find something that was more life threatening than having a pretty smile, let's say, and guide them to the right, specialist to get that addressed. I mean, those kind of feelings are very different than the before and after in the mirror, and everybody loves that, and that's fun, and that's sort of my passion on the technical side of dentistry. But it's very different, if someone tells you that you saved their life by something that you found and sent them to, and that so I think that's where we're headed.
Right. I am. Yeah. What good is it if I have pretty teeth if my mouth, this body is falling apart?
Exactly. And I think one of the things too is that we don't want to initiate an oral health problem in the name of doing a cosmetic procedure. And I think, in social media now, especially with the quick turnaround times, and everybody wants a veneer process and they want it right now, and they want the result, and there's a skill set that has to happen that integrates this material with your mouth and with the tissue, so that you're not creating a gum problem, which creates body problems, because you wanted veneers or because you wanted a pretty smile. So you can have both, but one shouldn't cause the other. And I think
Right.
that's where in the age that we're in now of quick procedures and quick turn times and things like that, that we're missing a lot of that. And then I think, people down the road are going to be presented with different types of problems, as a result of that.
And that's you said something about setting the standard and how that's changing. I mean, that's a
Right.
big part, and also why I've always loved watching you and what you're doing is you really do set a standard. And I think you've done that with smile art and prepless veneers. I mean, in everything that you do. What do you feel is the gap now in setting that standard? And what has that standard been for you? Like, why is that so important to you?
Well, I think sometimes we're taught a standard, when we're in dental school, and some practitioners never get off of that standard,
Right.
and for me, that standard, would have been 1995. And if I was still living by that standard and wasn't able to adapt to what's happening now or where science is headed or materials or anything like that, it doesn't mean that I'm not necessarily a good dentist, but the standard of 30 years ago isn't the standard of now.
Yeah.
So I think part of all of our journey is to recognize where standards are changing and what a new standard might be. So our standard diagnostics now are very different than the standards that we had when I was in dental school. So the imaging capabilities that we have changed the standard. Materials, and so, when I started cosmetic dentistry, and I'll just use that as an example, all cosmetic dentistry was basically more of a prep design because we had to accommodate for the thickness of the materials at that time.
Right.
So that's, I came along when the chiclet term was invented because, people did not want to adjust the tooth or the teeth if they didn't have to. But because the material was so thick, it gave this big, blocky, opaque look that in the short term, people really liked it because it was better than what they had before. But in the long term, it was creating gum problems because that adaptation of the tissue was not good. The opacity of the product wasn't that good. So dentists learned that, well, if I reduce the tooth to accommodate the material, then I eliminate that bulky, thick look. And so that's where prep really came in. I think aesthetic dentistry in the beginning was really designed to be non-invasive. But as the material failed in the aesthetics, we accommodated the material by removing tooth structure. And so doing that, and removing tooth structure isn't wrong. It's just it's got to be done respectfully. I mean, it's got to be done intentionally.
Right.
And I think what we're seeing now is so many people want to get into cosmetic dentistry that they're just doing the same type of prep design that they learned in dental school, and they're not even taking into account what the material is capable of now. So as I went through my cosmetic journey and I was fortunate to have some great mentors, and one of them is Dr. Hornbrook that and in doing that you kind of learn the material along with the procedure, and the more you know about what you're working with, the more you can adapt your technique to it. And so my standards changed, right?
Yeah.
So then I begin to say, all right, well, now these materials can be thin when they used to have to be thick. So that means I prep less because I don't have to accommodate for the material. And
Right.
then ultimately, when COVID happened, I was doing virtual consults, and it seemed like everybody that did a consult was about 30 years old that had really nice teeth, but they just wanted a perfect smile. And I'm like, well, how can we not do anything to these teeth then? Because I don't want to do that. So that's when I got with my ceramist, Josh Walker at Utah Valley. And we said, well, how thin can we do this? And so that's when you really get down to microns or tenths of millimeters. And so when you can build a product now that can be 2 or 3 tenths of 1 millimeter, that used to have to be a full 2 millimeters, it gives you more options. And so you just move your standard and to say, well, if I can get the same result or even close to the same result without having to be reductive to a tooth, then that's what I'm going to do if that's going to meet the patient expectation. So that's a long answer, but the answer is, like, you always have to be willing to look at the science, the materials, the data, so that you can put your standard where it is now.
Right.
um, and I think, some of what we're seeing, and you and I talked about this kind of pre-recording, is that who's setting the standards though? because
Yeah.
that's very different now than when I was coming along. When I came through, like you had to, I'm a Gen X person, so I'm almost like you got to prove that you know what you're doing to me, right? So there's a prove it mentality, and when we've got accreditation possibilities, we've got organizations that offer credentialing in cosmetic dentistry, and you just choose to not do it. Well, that doesn't make sense to me,
This is what I was going
because
to
if
ask.
I really believe that I want to be this particular thing, then I want to learn and train the skill set to do that. And that doesn't mean that individual dentists aren't good mentors.
Right.
But I think at the end of the day, you also have to think that we are healthcare providers, and in doing that, we're always going to be subject to some type of litigation if this doesn't go well. And so, in practicing for 31 years, I've been blessed to not have to deal with that ever. Knock on wood. But you always have that in the back of your mind that you better know what you're doing, because at the end of the day, you are responsible for your result. And your community or your friend group or all your buddies that are telling you how great your cases are on social media, they're not going to be there in a deposition room. They're just not. Where you have to fall back then is on, well, what was your skill set to get you there? Because your credentials, your skill set, basically your CV and your bio is what's going to protect you along the way. So I just think it's incredibly important that the standards in dentistry are monitored, so that everyone kind of has the same level of skill set, because it varies so much right now that there's some wonderful cosmetic dentists out there. But how does a consumer actually know? Because if I'm out there saying that I'm the best cosmetic dentist in Nashville, anyone can say that.
Right.
But
Oh,
how do you prove that?
yeah.
What
Oh,
are the credentials to get that? So from as a consumer trying to search this out and pick the right person, I think it's a pretty tough ask right now, for people to really know. So that was a long answer to
no,
standards.
that's it's huge, and it's leading
Yeah,
into everything that I want to touch on. I mean, so you have this way that you learned. You continue to innovate, and what I love about you, and you mentioned Dr. Hornbrook, is you guys, the way you teach. I mean, he teaches to a lot of students and young dentists, which is phenomenal, and you do too. But you also help people that have been doing veneers and get more advanced. So there's lots of ways to learn. But what I love is that you do take the time. You have the accreditations. You have the experience. I mean, you have all of that behind you, and you want people to have the path of least resistance. You've already made the mistakes that people don't have to. And
correct.
I love that you're so willing to share that and collaborate, because I feel like you really understand that when you're able to help someone else be successful, we're all successful. It's not taking from one another.
Absolutely not. And I think, I'll keep going back to cosmetic dentistry because it's just popular right now. The worst thing that can happen is a case fail.
Right.
Um, you know, because of whatever the reason was. I mean, and we've all had cases that didn't work out,
Sure.
like we wanted them to. And, if it comes down to it, you got to figure that out yourself. Like you got to get yourself out of that. How do you fix it? How do you make it right? What do you do? And those are really tough spots to be in. And, every dentist that's been through that knows that those are sleepless nights and really stressful weeks while you're trying to figure out what's going on. Because from a patient perspective, they wanted one thing, and now they're getting something that's not working. And
Right.
that goes from, high fives and smiles in the after mirror to how are we going to rectify this? And so I think our job as educators is to say, look, everybody's had things that didn't work, but let me tell you why this didn't work for me.
And
And
what
let
I
me tell
do
you
too.
how I got out of that and how we fix that. Because I think, you know, all of us don't want to see another practitioner have to go through that, not just because of them, but also that patient's going through it.
Yeah.
No patient wants to come into an office thinking they're getting veneers and walk out of there with zirconia crowns. They don't know the difference. And then 6 months later, one of their cuspid crowns falls off, while
Yeah.
they're on vacation. So they have it resubmitted while they're on vacation. 2 weeks later, another one comes off. But if we're not, able to discuss how these things can go wrong, and the skill set that it takes to make sure they don't go wrong. It's I think that's where our obligation is from a teacher mentorship is to kind of take, well, what's the worst thing that could happen, and then let's make sure that doesn't happen.
I love that.
Yeah,
That's what students
because
want.
at the end of the day, we want to protect our patients, we want to protect ourselves, we want to protect our sanity, we want to be able to sleep at night, and so the more information that we can give people on how to be successful at that, I think helps primarily the patients. Because at the end of the day, they're the ones that we want to take the best care of. And I think while we talk about dental community and things, I think it's great to have friends in the industry and to have people pat you on the back and have a support network so that you can have these kind of conversations with one another. But I have also been on the other side of the legal system where I've had to evaluate cases for attorneys and recommend either proceeding or not for dental boards and things like that. And what you hear from that side of it is very different,
Right.
because the reason they look at me on these things sometimes is because of my credentials. Because at the end of the day, you have to have something to back you up if there's an issue. Like, you don't ever want there to be one.
No.
But if there is one, it's your credentials that are going to help you navigate that process. And, so I think I mentioned earlier when you and I were talking, it's like I'm an educator and I can tell you how to do things, but you need to know more than just because it's worked for me for a couple of years in my practice.
Yeah.
Anyone can make a cosmetic case work for a couple of years. It's how long after that?
Right.
What is cause the failures? What materials did you use that didn't work? I mean, one of the things that, sorry, I think I'm doing all the talking. Why don't
No,
you?
I'm eating this up. This is fantastic.
Well, we just have to ask questions, because just to take someone's word for it, whether it be a lecturer, whether it be on social media, or whether it be a friend, you have to have more scientific validation to make clinical decisions than that. Like,
Right.
you really do. And, one of the things that's popular right now is, or at least from what I see, is 3D printed veneers. And the reality is most people don't know what those are.
Right.
It's basically, you're using a 3D printer to mill a composite hybrid material that does have some porcelain particles in that.
Yeah.
And it is stronger than composite veneers. But there's no history here. Like, this is
No.
all new. So it could be a great product, but it's never going to be porcelain. And it's in between porcelain and composite veneers. But you're using a 3D printer to make teeth out of essentially resin, even though it's a stronger filler particle size. So at the end of the day, do patients want to be experimented on that if they knew that there's no real long-term evidence that these are going to last 5 years? And
Yeah.
and it's another thing too to say that a product is going to last. Well, if you can't afford porcelain right now, well, then let's compromise. And I think that's smart to have other options. But where I think people don't think that through as a patient would be
Oh,
like,
wow.
yes, okay, if composite or printed veneers are half the cost, I can do that now. And that's a great option, but you have to understand at that point you are obligating yourself
To do
to
it.
another set of something.
So you're
And
paying more for what
that
you
could
think is.
be 2 years, that could be 10 years. But at some point, you're obligated to have another set of dental appointments to re-engineer this to something.
Yeah.
So to me, it ends up not being cheaper,
No.
because the time of dental appointments, of redoing, of what's going to happen when this does fail, and how's it going to fail, and what's it going to look like in 3 years, really? Like, is there really science that tells us this is going to look brand new in 3 years, or it's just going to be still on in 3 years? Because we all know resin itself, if it's done incorrectly, will stain very quickly. So
Exactly.
the skill set of the provider has to be really, really good. Well, how do you know? So was it a weekend course on printing veneers? Nobody. So that's what I mean. That there's a lot of variables in this that I think really need to be communicated well. Because if I was a patient and I said, well, porcelain veneers have an indefinite lifespan. I mean, porcelain as a material, not going to break down. That doesn't mean things can happen. But I have cases that are well over 20 years. They don't all last that long because of variables. But I
Sure.
do know that's the gold standard of strength. Like I know that material is going to be there and I can be it's very predictable long term. So I'm very confident in recommending that. Outside of that, there's a lot of gray area. I really
Right.
think that there is. So I don't want to keep talking about cosmetic dentistry, but those are things when you talk about standards, there's not a ton of information out there sometimes on some of these products and materials that are available. And as dentists, we have to be willing to do the research ourselves
Right.
and look for the research that's going to support your decision because you're responsible for what happens.
So it sounds like, I mean, so two parts here. So whether you're a patient or a dentist that wants to grow and elevate, or a patient obviously that wants dentistry, you need to check the credentials, period. I mean, you can
Yeah.
be part of a great community, but that doesn't mean you do great work. It doesn't mean you have the experience, and it doesn't mean that they're going to back you if something goes wrong.
Right. I mean, I think being good at it is important. I mean, everybody's going to have a natural ability in certain areas of dentistry. I do not like to take teeth out. It would not be my thing to do wisdom teeth or place implants. It's just not me. This is not my skill set. Um, but I don't do that.
Yeah.
Right. So it's like you have to make, so if I've got a natural talent in cosmetic dentistry, then I need to make those steps so that if I'm going to perform these procedures, that I'm also building my credentials along with
Right.
advanced training
Yeah.
so that let's say like if I did get in some type of litigation, then my credential is going to say, well, I was accredited in the only accreditation process that there is right now in cosmetic dentistry, or I'm a fellow in the Academy of General Dentistry. And while some dentists kind of laugh that off like it doesn't matter, well, it matters then.
Yes, it
Then it
does.
really matters. It may not matter to my patients. It may not matter to my dental friends. They may think it's dumb to try to go through those things, but at the end of the day, those are the bookends that they'll create enough validity to say, well, this we can prove that he took the time to learn, and this was just an off day or something happened, and then we can kind of come to some resolution on it. And I've just seen that happen. That's why I know that it does happen.
Right.
And so for me going into these procedures, I like to know that I have the sort of the support structure
Yeah.
because every single cosmetic case that you do is hard on all of us. It's never just easy,
Right.
right? It's always stressful. You always have patient expectations to meet. That standard of aesthetics changes. 3 years ago, everything wanted to be bigger, wider, and wider. Now everything's moving more to be more natural
Yep.
and more delicate. So, anyway, I think we can talk about gum tissue because I think I've worn that topic out.
No, that's good. I do want to talk to you about that. I have a quick question. So I keep seeing on social media, this is new. Um, Clearly you've never gotten your nails done, but when you do acrylics, they do like a gel and they cure it. I'm
Right.
seeing people get veneers on social media where they're basically just painting them on. Have you seen that? What is that?
Yeah, I mean, so you're really just talking about bonding. You're trying to put
Is that what they're doing?
a material on a body part. And frankly, when I talk about printed veneers, that's the analogy that I use.
Okay.
Is you're just taking something that's manufactured outside of the mouth, which all dental restorations are, but acrylic is the closest comparison that I can get to a 3D printed veneer.
Yeah.
And then that product is then bonded on to the surface of the tooth. But there's so much physics involved in teeth as opposed to fingers, right?
Yeah.
Uh, because functionality, I think, is sometimes really lost, in the name of aesthetics and materials. Because
Right.
if your primary motive for doing a resin or printed veneer versus porcelain is cost, well, you're not considering the physics. like the physics of hanging that material down over the lower teeth. So
Yeah.
that when that patient functions and they're going into lateral chewing motions and all the functionality of chewing ice and going out to eat and all the things that these edges are going to be asked to do, and they're using in lateral stress, what's the functionality testing on this material? How long does this material last? And I've got one of my friends, Drew Ballard, is great at cosmetic composite veneers. I
Yeah.
love Drew's work and what he does. But Drew's done the research so that when he can tell you about composite resin and how he's going to do that in a veneer process, he's very credible in that. So it's not saying that one material is the best and the other is the worst. It's just how you apply that is critical. And if your only reason for it is money and cost, that's a very dangerous way to make a decision about a material.
Right.
Because at the end of the day, you tell this patient it's half the cost and you put that on there and they're in a clincher and a grinder and that material fails, well then immediately, if you're in litigation, they're going to go to the literature and say, well, what's the literature say about this product that your patient is this scientifically sound? What training did you have on this? Because this is not widespread in dentistry. So those are the kind of things that you have to think about when you're making decisions. In
Huge.
my opinion, in my opinion,
Please, yes. Look at the big picture. Yes.
yes.
Um, that is huge. So going back to oral health, the gateway, what I like, even the tests that I experienced in your office, help us understand how this has been a part of your practice, how it's helping
Right.
patients, and how it's evolving.
Well, I was, fortunate. My father was a dentist, so I grew up in this, and his generation was that the dentist was everything. They were the orthodontist, they were the oral surgeon, they were the periodontist, they were the pediatric dentist. They were just your dentist, and you didn't have all these options. And one of his main questions is that in gum disease or periodontal disease, why did some people get better and some people not get better, but everyone got the same treatment? So if the treatment was sound, why did it work for some people and not work for others? So again, it's asking questions
Yeah.
like why is this happening? And of course, back then all you had was phase contrast microscopy, so you could take a plaque sample and look at it under a microscope of healthy, and then you could look at it under disease, and they're very different. And back then you could identify the bacteria visually, and that certain things were supposed to be there called a pathogen and certain things that weren't supposed to be there, that's called commensal, that's just part of the community,
Yeah.
and that if the bad was better than the good, then you had disease. So it's very cause effect. But over time, DNA PCR testing came into healthcare, which is just looking at the DNA of bacteria, at least in our field. And so we were able to start a salivary diagnostics company called Oral DNA Labs, and it was the first salivary diagnostic lab in the U.S.
Uh-huh.
And so we were able to really look at what's happening here. And I think I'm going to call this like a nerdy science name, but it's called taxonomic profiling. So
Okay.
just to make it sound like an investigation discovery. So 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 taxonomic profiling is basically where you take a salivary sample and you look at what's there, the taxa, like what bacteria are there. It's called taxa. So we could say, all right, there's 11 species of bacteria that cause gum disease. So let's eliminate those either by our therapy. Sometimes an antibiotic is used, but let's develop a system so that we're targeting the cause or the why this is happening,
Right.
not just the what is there. Like the what is there was plaque and calculus or plaque and tartar. But is that the problem or was it something else? So these are all 30 years ago questions.
Yeah.
But what we begin to realize that it's plaque and calculus are just like dirt and debris. I was like, your hands don't get sick because they're dirty. Like your fingernails don't get sick or your fingers don't get sick because you have grease and grime under your fingernail. So this pocket around the tooth is engineered to be
Making you
pretty
stay
stable,
strong.
right? So if
Yeah.
you go back to your fingernail analogy, things come out of skin, eyes, hands, fingernails, whiskers, eyelashes, and all of those the little things have to have a junction where they come out of skin, and so do your teeth. So
Yeah.
it's not really all that different. Something's coming out of skin, so the skin then creates a barrier. And in that barrier is designed not to just get sick every time it gets dirty, right? So hygiene is important, but hygiene doesn't treat anything.
Okay.
So if you think more hygiene is going to treat an infection, it just that doesn't make medical sense,
Interesting.
right? So that would be like if I cut my finger and it was getting infected, I wouldn't just keep cleaning it. I might add an antimicrobial like neosporin or alcohol or iodine. And if it
Yeah.
got bad enough, I might even need an antibiotic because I don't want to lose my finger, right? So unfortunately, these infections that we're talking about are in our head,
Yeah.
which is the closest area to our brain and to our heart. So if you think about where this infection is, and then you start looking at, well, the microbes that are associated with it, well, it would make sense that gum disease is related to heart disease or gum disease is related to brain disease because where this infection is, it's right there anyway. And our body's going to protect the brain over everything else.
Yeah.
So if by the time you're starting to connect the dots between, let's say, Alzheimer's and oral health, it's already been going on.
Yeah.
So back to my nerdy term, of taxonomic profiling, that's all we could tell you though, with the original test model was what's there, which is very helpful. It's like strep throat. Like you take a strep test, it's there or it's not. If it is, here's amoxicillin, that'll take care of it.
Right.
So all of our therapy was built basically on just trying to know what was there. But what's happening now is got a different name. It's called functional profiling, right? So
Okay.
you probably heard of function health or some of these other
Yeah.
wellness tests. So wellness tests look at more than the taxa, like what's there. They look at what's there doing.
Okay.
And that's the cool part. Like,
Interesting. That's cool.
so what's there is there, but what's it doing?
Yeah.
So an example might be staph infection or staph bacteria. Like you and I have staph on us right now, and we know that could create a very dangerous infection, but we're not sick from it.
Right.
So if I just did a taxonomic test, let's say on staph, I would be positive
Interesting.
and I could freak out. Oh my gosh, I have staph. Treat me for that, dermatologist or whatever, So functional means that, well, it's not hurting you. Nothing's happening. Your body is handling that. It's not invasive. So don't worry about it.
Yeah.
So we're bringing what we're doing now is we're going to be, I say we, because I've started another company called, or with not just me, but I'm part of another company called Enamor Health. And we're starting to bring functional profiling into the equation so that it's not just what's there, but what's it doing. And what we know about saliva now is it's a gateway fluid of information. So if we're looking at, let's just say malodor, bad breath, like it's a problem, it's embarrassing, everybody knows about it. But if I ask you, well, why is it happening? It's one of the most common things that people are embarrassed to ask about is why do I have bad breath? And the reality is most of us don't even know why it's happening.
Right.
We just mask it with a product.
Yep.
Right, brush more, use mouthwash. But again, you're just throwing a product at a problem that you don't understand, which
Yeah.
would be
Not
like
fixing anything.
throwing a veneer that's thick. So your answer is to cut the tooth away, right?
Yeah.
So you can't just throw a product at a problem until you really understand the problem. Because then I think it helps you make better decisions. And I think it's no different in healthcare. So if you could say, well, it's the sulfur compounds in your mouth that cause halitosis. So how can I fight sulfur compounds? Oh, well, if it's just fighting sulfur compounds, well, then let's use this product because this product will reduce sulfur compounds. Or you could use nitrate. Or you probably everyone's heard of like nitrate, nitrite
Yep.
in the oral health because that's good for heart health. Well, you can measure that in saliva. So you can give your patients information like, well, this your nitrate level is not good. So let's use this product to really help with that. And maybe it's beet extract or maybe it's a supplement. Only because you're a great dentist or a great hygienist, you can give your patient this kind of information now. But I think we're just on the very cusp of knowing what saliva is going to be able to tell us. You know, we all know that Alzheimer's is related to oral health, but that's
Yeah.
such a generic way to say it. What is it about the saliva that actually is related to this? Is it proteins? Is it enzymes? Is it exosomes? What is that factor that we could identify in saliva that could help prevent Alzheimer's or dementia? And that's where this is going. I mean, I can't, wish I could promise it because we've all had family members that suffer, from one of those two things, and it's horrible. But I think we're on to something. Not our company. I'm just saying the mouth is, when I say this, like one of our slogans is, "Your mouth is trying to tell you something," which is just interesting because it actually can tell you far more about your whole body than just teeth and gums. And I think that's the exciting part for us is we're opening a window of healthcare where I think we're going to be tied so much more to general health and prevention and wellness than ever before. And so I'm glad I'm around to see it.
Yeah. I mean, I don't want to say that dentists have guessed in the past. I just want to say that you're not guessing.
Mm-mm,
You're doing
no.
everything very intentionally, and it shows in your practice and with your patients. What was the name of the company again?
Enamor, Enamr,
Okay.
health.
Very, very cool. Now,
Yeah.
um, I'm obsessed with all of this stuff. I get very nerdy. But from a high level to, maybe potential patients that are hearing this, like what are things that you're finding? What are you seeing? Like what is changing for them because you're doing this?
I mean, honestly, what we're seeing is that a lot of basic home care can really be more preventive than we're giving it credit for because we understand so much more about what's happening. So I think if patients, I can use this as an example. If a patient knew that they do have, let's just say gum disease, since we're talking to a patient, and that it's an anaerobic infection, right? Well, what does that even mean?
Right.
I mean, so understanding, like, again, going back to understanding what you're going after. So, not to be biology nerdy on it, but this is basic biology. Anaerobes, aerobes. It's two different kinds of bacteria. Aerobes live in air, oxygen. Anaerobes can't live in oxygen. So then, well, what's a biofilm? Because that's another term.
Yeah.
Hygienists use that all the time. Well, a biofilm is like a force shield. Like it's like a protective layer that anaerobes use to protect themselves from oxygens, right? So, I mean, that's an oversimplification, but it's almost like if I've got an infection that's anaerobic and it's in my mouth, well, that's full of air all the time. So how do they protect themselves from that air? Well, they build communities, and in those communities, that's called a biofilm. So what's a great way to stop an anaerobe? Air.
Yeah. Yeah.
So what's in water? H2O.
Yeah.
Natural antimicrobial. It just has to get to the right place, right? Because if bacteria are easy to get rid of, we'd never get sick. So that's an oversimplification. But if you understand, Mr. or Mrs. Patient, this is an anaerobic infection. I'm going to put you on a water pick irrigator because I want you to use this product in there because what we're trying to do is break up this anaerobic infection so that you're getting oxygen into these areas of your mouth that lack oxygen and are allowing this to propagate and get worse. So that's a different motivation for using a water pick than just saying, just use a water pick or rinse with mouthwash
Right.
or fake it with a product because you don't have an answer. That's what we're trying to say is like understand a little bit more and then you can guide. So I think that's what we're seeing is if we can get oxygen, if we can get antimicrobials in more of a lavaging irrigation action, then patients at home are going to be a lot healthier. It doesn't mean it's going to stop advanced disease. I think you're always going to have professional intervention, but I think our professional intervention needs to be more focused on conservative means of getting there, lower use of antibiotics because we're understanding a lot about that now. One thing that AI has done is allow us to take everything that's ever been written about antibiotic use in the treatment of periodontal disease and then apply that to new recommendations. Because when I was first starting this 20 years ago, we only had a threshold mark based on the literature that we had then, and
Right.
everybody over a certain threshold got recommended an antibiotic. Well, now, I mean, that's different. It doesn't mean that it's not still helpful, but I think you can be a lot more responsible and a lot more precise about that now. So that's what it's telling me. It's telling me that patients that don't have access to dentistry or access to great care will have access to science information, so that if they know that halitosis is caused by sulfur compounds, then let's get them a zinc related toothpaste or something that has zinc in it, because that's going to bind to the sulfur and it's going to help them with that. So I think at the end of the day, it's just giving all of us a lot more information, patients and providers, to make more educated decisions and actually help, and not continue kind of the same, maybe this will work or let's try that.
It sounds like both on the on both sides, we're getting rid of the guesswork and we're doing things with data now.
Yes, absolutely. I just call it truth.
Yeah, I love that.
Yep.
So I mean, I think biggest takeaways today, I mean, with all the innovations and everything, no matter what you're doing, make sure that you're partnering or working with dentists and practitioners that have the experience, that have the expertise, and have the accreditations. This is also something in a branding and SEO world where Google, the language models, Instagram, they're all looking for that experience, authority, and trust is what they want. So
Hmm.
make sure that's also something that you're incorporating, right?
Oh, absolutely. And you and I've worked together for a long, long time. And the thing about branding is it's because there's so many people in the world like is yourself that can teach
Yep,
us how to do this. But it's really up to us. That sometimes I think we want to make the brand become more important than the skill. Because I'm sure if you're helping someone brand and you really can tell that they they don't have the underpinnings to support the brand that they're wanting, that puts you in a tough spot.
absolutely.
And so I think as a coach, you're not only trying to coach people on how to build their brand, but actually how to be the brand. I think that
Yes,
that's a different. That's
yes,
very different. So what do they call it? Be who you say you are.
yes. Well, and that's
That. So
yeah,
that's a process. And I wish you could rush it. I mean, I wish it was fast. But just experience, skill, training, mentors, all of it plays a role in it. But if I was giving advice to younger dentists, I would say don't rush it. Just be a really good dentist. Do
yeah,
really good work. Like help people stay healthy. Make your work stand out because it was easy and it was good and your patients love you. And then as you get better, look for mentors, but always make it fundamentally correct,
yeah,
because at the end of the day, you'll sleep better. You're not making decisions with your wallet, which is not a way to run your practice.
no,
Do the right things for the right reasons, and your practice will take care of itself. And then you can have a brand that you can be really, really proud of. And I think that's a combination effort. You can't do it all yourself. You got to have somebody like you because we don't understand anything that you say half the time about SEO and Google and all that. Like I didn't even know how to do the live thing. So
yeah. No,
that's why we have to have help. Yeah.
it's I
Yeah.
love working with practices like you and ones that walk the talk because you do make my job easy. All I have to do is present you. You've done the
Right.
fundamentals, you've done the work, you have the patience. So the rest is on me and that makes it easy. So you are living proof of I mean when I no matter what, when I go to your socials, Dr. Thomas Neighbors, when I go to your website, when I Google you, you have a brand and aesthetic. When I go there, I'm not going to call and price shop you. I know I'm going to the
Right.
best. And that's
Well,
something
I
that you
appreciate
feel.
that, but it's come from people like you that have helped us. I tell everybody, like in during COVID, I did not know how to log into Instagram.
Right?
Yeah, so in 2020, that's when my journey really began. I think Dr. Brian Harris was very instrumental
Yep.
to me in that and the virtual consult realm and being able to present your work on social media as because before that, all we had was a before and after book and a reception room. That's all I had, and a website. But post COVID, I mean, it really taught us how to get our information out there. But I would liken it to something you and I discussed. Like every post is your Super Bowl.
Yeah.
I just you just can't. throw something on social media and expect that to change your practice. If anything, it could be a negative reflection on your practice if you don't know how to do photography and you don't know how to frame images and you don't have a system in place to manage all of that. It can actually be detrimental to your growth. So, I think sometimes dentists are a little overconfident when it comes to putting things on social media because
Yeah.
you got to be right every time. Like your posts have to be right every time.
Yeah.
Because it
Well, and
only takes one. It's kind of like a reputation, It's like you can build it all. We've all seen celebrities do this. They post one dumb thing, and then that's it.
yeah.
Then you're in rebuild mode. So use somebody like Brittany to help you with this for sure.
Well, and you and Allie has done a phenomenal job on your socials. I don't know if you heard this, but I want to say it was this week for sure. Google Console just introduced Instagram is coming up in the search results now. So
All
all
right.
of those descriptions and everything that she's been doing and that you started doing since 2020 is going to
Yeah.
be making a huge impact on your SEO now. So
Oh, that's awesome.
yeah, we talk about all the innovations that's happening in dentistry. Well, it's happening on this side too, because you don't just have your website, your socials, and all of these disconnected pieces. Now we're combining it together and we run a revenue system. So that's something
Yes.
we're working on. So
Oh, that's awesome, Brittany. It really is. It takes everything. Like Allie and I talk about this. You just can't have a good website. You can't have a good Instagram account. It all works together. And I think it
yep,
all kind of has a community of your brand that all has to be connected.
it is
And yeah, you do that beautifully well. So
awesome. Well, a pleasure meeting with you today. I do,
likewise.
if you wouldn't mind, just give a brief overview, your practice, your website, how to reach you, and then also Smile Art and the courses you have coming.
Yeah. Yeah. I mean, we love teaching. I've been doing this so long now. I just, feel like that's an important thing to do, when you've had 32 years experience or so. So our Smile Art is just our education arm of what we do. And so we teach our perio courses on what we've talked about here. We teach our aesthetic courses there as well. So I always appreciate, the opportunity to help anyone with things like that. Our website is just thomasneighbors.com. Instagram is just at Dr. Thomas Neighbors. And, for any providers out there, if you ever have questions or you just want to reach out, and message me, please do. I think that is part of the community that's really is important. I mean, you do have to have friends, you do have to support one another, you do have to create kind of your groups so that you do have the ability to talk about things because dentistry is a tough job, it's a tough profession, and you do need to have people that understand that. But I did think on the flip side of that too, all work on getting your credentials, your assessments in place because I want to see you have a healthy practice, a healthy life, sleep at night, and not have to worry about clinical decisions because I think there's enough information out there now to give you the information so that when you do make a clinical decision, you're going to be backed up by science and your results are going to show. So that would be my last word.
I love it. Thank you so
So,
much. Thank you for
you
joining us.
bet.
Have a great weekend, everyone. And
All
that's
right.
us for What's the Buzz. Bye for now.
All right. Thank you.
Thank you.